Hi, welcome back. Today we're jumping into a topic that affects so many yet is so overlooked: the rights and responsibilities of elderly patients. Whether you're a senior yourself, a caregiver, or simply someone who wants to advocate for the elderly in your community, this episode is packed with valuable insights. We'll cover what rights elderly patients have when receiving healthcare, the responsibilities in ensuring the best possible care, and how we can all work together to protect and advocate for them. So grab a cup of tea, get comfortable, and let's get started. Welcome to the Care Chronicles with a Caring Touch, where compassion meets wisdom in every episode, dedicated to our beloved seniors and caregivers. Join us as we explore the heartwarming stories, experts' insights, and practical advice that make every moment with our elderly truly special. Get ready for insightful conversations, practical tips, and heartfelt moments that warm the heart and nourish the soul. Because here at A Caring Touch, we believe in laughter, learning, and love as essential ingredients to aging gracefully. So tune in, relax, let A Caring Touch be your guide to making every moment count. Picture this: your loved one, an elderly parent or grandparent, is sitting in a hospital room. They're confused, overwhelmed, and unsure of what decisions they can make for their own health. Perhaps they're being rushed into a procedure without understanding their options, or maybe they feel unheard when they try to express their concerns. This is a reality far too many elderly patients have. They often don't realize they have rights: the right to informed consent, the right to refuse treatment, the right to be treated with dignity and respect. And unfortunately, when these rights are ignored, these consequences can be devastating. Let me share a story. Meet Mary, an 82-year-old woman who went in for a routine checkup but was pressured into a procedure she didn't fully understand. Her doctor assumed she wouldn't question it, and her family wasn't present to advocate for her. After the procedure, Mary experienced complications and was left feeling helpless and disregarded. Sadly, Mary's story isn't unique. But today, we're here to change the narrative by educating ourselves and taking action. So what rights do elderly patients actually have? Let's break it down. The right to informed consent. Every patient, regardless of age, has the right to understand their medical condition, treatment options, risk, and alternatives before making a decision. The right to refuse treatment. Just because a doctor recommends a procedure doesn't mean an elderly patient is obligated to agree to it. The right to privacy and confidentiality. Medical records and personal information should be protected. The right to quality care without discrimination. No patient should be treated differently due to age, disability, and/or financial status. The right to have an advocate. Whether it's a family member or a legal representative, seniors have the right to bring someone with them to appointments and medical discussions. The right to be treated with dignity and respect. Healthcare providers must honor elderly patients as individuals with voices that matter. The next time you or a loved one faces a medical decision, remember these rights. They are not optional, they're fundamental. Now, with rights come responsibilities. Here are a few ways elderly patients can take an active role in their healthcare. Be honest about symptoms and history. Providing accurate information helps doctors make the best medical decisions. Ask questions and seek clarifications. If something isn't clear, don't hesitate to ask. Doctors and nurses are there to help. Follow agreed upon treatment plan. While seniors have the right to refuse treatment if they agree to one, they should follow it as best as possible. Respect healthcare workers and fellow patients. Kindness and respect create a better experience for everyone involved. Plan for future care. Discuss advanced directives and living wills to ensure that medical wishes are honored. By embracing these responsibilities, elderly patients can be proactive partners in their care. So how can we ensure that elderly patients' rights are respected? Educate and spread awareness. Share this episode with friends and family. Knowledge is power. Encourage open communication. Sit down with aging loved ones and discuss their healthcare wishes. Be present at appointments. If possible, accompany elderly family members to medical visits. Report violations. If a hospital or facility neglects a patient's rights, report it to the proper authorities. Use legal tools. Make sure seniors have advanced healthcare directives and powers of attorney in place. These steps can make a real difference in ensuring elderly patients receive the care and respect they deserve. We've covered a lot today, but the message is simple. Elderly patients have rights, and it's up to all of us to uphold them. Whether you're an aging adult, a caregiver, or just someone who cares, you have the power to advocate for better healthcare experiences. So here's my challenge to you. Take one action today, whether it's having a conversation with an elderly loved one, looking up patient rights laws in your area, or simply sharing this podcast. Do something that helps protect and empower seniors. If you found today's episode valuable, please subscribe, leave a review, and share it with someone who needs to hear this. And if you have any questions or stories to share, reach out. I'd love to hear from you. Thank you for tuning in to the Care Chronicles. Until next time, take care, stay informed, and be an advocate for those who need it most. Thank you for joining us on this heartwarming journey with a caring touch. Be sure to check out our website and connect with us on social media for more stories, resources, and ways to get involved. We're excited for you to join us again in our next episode, where we'll continue to explore the beauty of aging with grace and compassion and dive deeper into topics that matter to our elderly community. Until then, stay connected, stay caring, and we'll talk to you again soon on the Care Chronicles with a caring touch.